All right, good evening, folks. Welcome to SUPERPoints. And we are going to review some important questions in physiology. And we are going to review the most important things. That's why we call this SUPERPoints class, because these are the points you must remember in order to get a super score on your examination. So welcome to this physiology class, everyone, wherever you have been listening from or watching from. So let us see this question. A 45-year-old man who has 5 children undergoes a vasectomy as a permanent method of contraception. After the procedure, his semen will no longer contain sperm. Which part of his reproductive tract will no longer receive sperm? I will give you a few seconds, so choose the right answer here. So the right answer here is ejaculatory duct. Okay, that is the very important section you need to remember. So the right answer here is ejaculatory duct. The why? First of all, know the topic. We are studying effects of vasectomy on sperm transport and semen composition. And remember, knowing the topic, that itself eases your mind. What are you studying? What in the world is this question about? So if you know the topic, that clears up your mind a lot. So always look for the topic. What am I being asked? What is this question is all about? This question is about effects of vasectomy on sperm transport and semen composition. In males, sperm is produced in the seminiferous tubules, okay? Then transported through the rete, testis, epididymis, and vas deferens before entering the ejaculatory ducts, where it mixes with fluids from the seminal vesicles and prostate to form semen. A vasectomy involves cutting or sealing the vas deferens, thereby blocking the pathway for sperm transport. So, a vasectomy, what happened in a vasectomy? In a vasectomy, what are we cutting? You should know that we are cutting the vas deferens. Okay, we are cutting the vas deferens. That's why after vasectomy, sperm production and maturation continue in the seminiferous tubules and epididymis. So sperm production is still going on in seminiferous tubules and epididymis. And the sperm on their way through vas deferens, they are stopped. All right. After vas deferens, this vas deferens goes under the prostate, and we have a seminal vesicle duct joining it. Then it forms ejaculatory duct, and it enters the urethra, and the semen goes out. So you need to know that anatomy in order to answer this question. Okay. So always think anatomically when you come out, when you have to answer these questions. So sperm production and maturation continue in the seminiferous tubules and epididymis. However, sperm can no longer reach the ejaculatory duct because the vas deferens is blocked. As a result, ejaculate is free of sperm. All right, all the seminal fluid is still present. So what is the super mnemonic here? How do you remember these facts? All right, that is where super mnemonics help you. So the one I use is this one, vasectomy, vas deferens cut. So what is happening in vasectomy? V for V. In vasectomy, vas deferens is cut and no sperm to ejaculate. Okay, so that simple sentence explains the procedure and the direct consequence. Vasectomy, vas deferens cut. The procedure cuts and seals the vas deferens. No sperm in ejaculate. All right. Therefore, sperm cannot reach the ejaculatory duct to be expelled in the ejaculate. Now, let us go to the incorrect answers. We got epididymis. Remember, I told you the sperm still mature and are stored here after vasectomy. So, even after vasectomy, epididymis, sperm still mature there. Then option 2, seminiferous tubules, they also working normally. So, if you look at seminiferous tubules, sperm production continues normally. What about retetestis? Retetestis transports sperm from seminiferous tubules. Okay, so it transports sperm from seminiferous tubules and still functional post vasectomy. So this is a very nice question to answer and to also to have an insight into vasectomy. SUPER formula. SUPER formula is about what you must know. All right, so certain keywords. If you see these keywords, you know the answer. All right. So, for example, if I say he is the Prime Minister of India, he has a white beard, and he belongs to BJP. I gave you those three things. And what would you say? Well, I know him. He is Prime Minister Narendra Modi, right? So, why? Because I gave you certain unique things. And those unique things reflect Narendra Modi ji, right? So, same thing in medicine or anything in the universe. Everything in the universe has certain unique things. And there are certain unique things about you, certain unique things about me. And by going through those unique things, you can identify who is that person or what is that particular entity. The same thing applies to anything, even in medicine. For example, if you see these particular words, you know we are talking about vasectomy. That is SUPER formula is all about. Look, it's a sterilization procedure. All right. The sterilization procedure that involves the surgical ligation or excision of a, let me get my pen right here. Sterilization procedure that involves the surgical ligation or excision of a segment of vas deferens, effectively creating a permanent physical barrier in the male external ductal system. And this interrupts the transport of sperm from the epididymis to the ejaculatory ducts. The result is, following the procedure, the sperm continue to be produced in the seminiferous tubules and accumulate in the epididymis, and the sperm is completely absent from the ejaculate. So, if you see those things, you know it's all about vasectomy. So, vasectomy is the sterilization procedure and excision of the vas deferens, all right, and interrupts the transport of the sperm from epididymis to the ejaculatory ducts. Following the procedure, sperm continue to be produced in the seminiferous tubules and accumulate in the epididymis. So, if you see those things, you know that is vasectomy. Or they may ask you in the reverse, just like in this question, after vasectomy what happened, like that. So, the SUPER point is very important. This is the point you need to remember, all right. So, after vasectomy, sperm are still produced but cannot enter the ejaculatory duct due to blockage of the vas deferens. So, vasectomy, blockage of the vas deferens, and the sperm cannot enter the ejaculatory duct. The sperm are still produced, seminiferous tubules are still working, epididymis is still stirring, rete testis still transporting, but that is not going beyond vas deferens to reach ejaculatory duct and later urethra. So that's a beautiful question, and I hope you got something out of it. Let's go to the next question. A 32-year-old man is evaluated for infertility. He has small firm testes and low sperm count. His hormone profile shows FSH is high, LH normal, testosterone normal, inhibin B low. Which of the following is the most likely cause of his condition? So there are 4 choices here. I will give you a few seconds. Go ahead and make your choice. So the answer here is number 3. Seminiferous tubules atrophy. Okay, seminiferous tubule atrophy. And as I told you, always think about what is happening, what is the topic, what are we talking about. Here we are talking about seminiferous tubule atrophy and infertility. Hormonal patterns, pathophysiology and differential diagnosis. Now, seminiferous tubules, what do they do? Seminiferous tubules in the testis are the site of spermatogenesis. They contain Sertoli cells which support sperm development and secrete inhibin B. All right, they secrete inhibin B, and in response to FSH, when seminiferous tubules atrophy due to injury, toxins, infections, or radiation, all those things, there is loss of germ cells leading to infertility and decreased inhibin B. So now, why option 3 is correct? Option 3 is correct because there is a low inhibin B. All right, low inhibin B. That shows there is loss of Sertoli cell activity. All right, and there is high FSH because of the loss of negative feedback from inhibin B, and there is normal LH and testosterone. Why? You know that Leydig cells are still functional, so Leydig cells are still working. That's why testosterone is still normal in these patients. And azoospermia due to absent sperm production. All right. So how do you remember this? Remember this. This is the mnemonic is all about. Mnemonic. Always try to remember, even using mnemonics. All right. They help you. Like some of these mnemonics may sound silly. Actually, sillier the better, because those silly things you remember. Here you see dead tubules, dead inhibin, all right, and high FSH. So dead tubules, dead inhibin, high FSH. Just remember that words. Seminiferous tubules dead, dead inhibin, and high FSH. Remember that sentence. Dead tubules, dead inhibin, high FSH. So when the seminiferous tubules are died and that atrophy kills Sertoli output, and Sertoli output has gone, there is low inhibin level, and that removes the feedback, and FSH rises sharply. All right, folks, that is the explanation to this question. And now you might ask, why not the other things? Why not the other things? Why not Kallmann syndrome? What is happening in Kallmann syndrome? There is GnRH deficiency, and in GnRH deficiency, there is FSH going down, LH going down, testosterone going down. Why not Sertoli cell only syndrome? All right. It can have similar picture, but usually testis size is normal and inhibin B can vary. Why not Klinefelter syndrome? In Klinefelter syndrome, we have FSH, LH going high and testosterone coming down, and the patient will have tall stature and gynecomastia. All right. So in Klinefelter syndrome, you are seeing those things. Now, how do you recognize seminiferous tubule atrophy? All right. I made this super formula. Super formula is all about recognizing those keywords and going from those keywords directly to the answer. All right. If you master this, you can answer any question within few seconds. For example, here when you see by the loss or severe damage of germinal epithelium within seminiferous tubule. So if you see that, okay, there is seminiferous tubule loss, there is severe damage to seminiferous tubules. You can expect that there is a decrease in inhibin B secretion, all right? Because inhibin B comes from Sertoli cells. You can say there is damage to Sertoli cells, all right? And because inhibin B is going down, there is a negative feedback of on the pituitary and a consequent elevation in the serum FSH, all right? So those are from Sertoli cell damage. But there is preservation of Leydig cell function. That's why LH and testosterone often remain normal due to Leydig cell function. And the testes are typically small and firm due to testicular fibrosis and hyalinization. All right. So if you see those keywords, you are looking at seminiferous tubule atrophy. All right. So seminiferous tubules, what you must remember about this condition is seminiferous, that is the super point, okay. Seminiferous tubule atrophy leads to infertility with high FSH, low inhibin B, and preserved testosterone due to Leydig cells. All right. So seminiferous tubules atrophy leads to infertility with high FSH and low inhibin B, preserved testosterone due to intact Leydig cells. If you want to study this subject more, pick up Gannon's Medical Physiology. That is the textbook I have been using. So you can also use the same textbook to follow these lectures with me. All right, folks, so that is a beautiful question you can expect on seminiferous tubule atrophy. Let us go to the next question. Testosterone in males is produced primarily by which of the following structures? All right, you can answer this question in a few seconds because I already told you while discussing the previous question. So, what is the answer for this question? Testosterone in males is produced by which of the following structures? The correct answer here is Leydig cells. All right? The correct answer is the Leydig cells. Let us discuss this topic. And what is the topic here? Leydig cells and testosterone production. All right, that is the topic. Know the topic. As I said, if you know the topic, that makes Lot of things easy on your mind. So testosterone is the principal male sex hormone and essential for the development of male secondary sexual characteristics and spermatogenesis. Testosterone is synthesized and secreted by Leydig cells. All right, remember that. You should not forget that. Okay. So if you are a medical student, you should know that fact. Testosterone production is stimulated by luteinizing hormone from the anterior pituitary. That is also a very, very important point, often tested in this examination. So remember that. Now, Leydig cells are the primary site of testosterone synthesis. They respond to LH by increasing cholesterol uptake and conversion to testosterone, which acts locally and systematically. Now, how do I remember this fact? I mean, to be honest with you, I also get confused between Sertoli cells and Leydig cells, what is producing what is doing what. So this is the mnemonic I usually use. I went late to the test, but the supervisor supported me. All right. So I imagine myself going to the test late, but the supervisor said, "Okay, that's okay, man. That's okay. Have your seat. It's okay. You are not that late after all. You can still take the test." And I am so relaxed because the supervisor supported me. So I went late to the test. All right. What do you mean by this nonsense? Here, late is like Leydig cells, and the test is for testosterone. So I went late to the test. So late is for Leydig cells, and the test is for testosterone. So Leydig cells produce testosterone. And the supervisor supported me. Supervisor here is Sertoli cells. All right, Sertoli cells. And he supported me. All right, they give support to spermatogenesis. So now tell me, what does Leydig cells do? Leydig cells produce testosterone. And what do Sertoli cells do? Sertoli cells support spermatogenesis. All right. So I went late to the test, but supervisor supported me. Leydig cells produce testosterone. Sertoli cells support spermatogenesis. That's a very useful mnemonic you can remember. What about incorrect answers? Incorrect answers, number one is Sertoli cells. As I told you, Sertoli cells support spermatogenesis and they secrete androgen binding protein and inhibin, but they do not make testosterone. What about seminiferous tubules? I told you earlier, it is the site of spermatogenesis and it does not produce testosterone. What about epididymis? Epididymis, and responsible for maturation and storage of sperm, not hormone production. So what is the super formula here? Super formula here is the primary androgenic steroid hormone in males. What is that? Testosterone. You see? When we say these key words and phrases, your mind is already thinking about the answer, right? So what do testosterone do? Male secondary sexual characteristics, libido, anabolism, spermatogenesis support. And now it is synthesized and secreted primarily by the Leydig cells of the testis. And where do these Leydig cells are located? They are located in the interstitial space between the seminiferous tubules. And what happens? What about the production? Production is they are directly stimulated by luteinizing hormone from anterior pituitary. And it acts via the androgen receptor and can be converted to the more potent dihydrotestosterone by 5-alpha reductase. So we are talking about testosterone. So those are the keywords When you see this is produced by Leydig cells, they are in the seminiferous tubules. This is the primary androgenic hormone. This is responsible for all the development of secondary sexual characteristics. If you see those things, you know they are talking about testosterone. So the super point here is that testosterone is synthesized in Leydig cells under the influence of luteinizing hormone and is essential for male reproductive and systemic endocrine functions. So that super point you must remember. Okay, you must remember that super point. And there are beautiful things. You can go to Ganang's medical physiology, and there is a beautiful description on this whole concept. But we have covered those core concepts here. Let us go to the next question. A 28-year-old woman with regular 28-day menstrual cycles takes a blood test. On day 19 of her cycle, she is not pregnant. Which of the following best describes the expected hormonal pattern at this point in her cycle? So you have 1, 2, 3, 4. There are 4 things here. There are 5 things here: estradiol, progesterone, FSH, LH, and inhibin. And how do they change? 1, 2, 3, 4. Okay. So take a look at those 4 things, and we will also discuss this question. So the correct answer here is number 1. Estradiol, progesterone are going up, FSH, LH coming down, and inhibin going up. So the best way to remember this kind of questions is to think about the menstrual cycle. First of all, what is he asking? The topic. What the heck are you talking about? What is the topic? The topic is hormonal regulation in the mid-luteal phase of the menstrual cycle. Okay, so he is asking about mid-luteal phase of the menstrual cycle. In your mind, you should think about that. And as you know, menstrual cycle is divided into 3 main phases: follicular phase, ovulation, that is around day 14, and luteal phase. All right. So in the question, if you see, he is saying day 19, right? So day 19 means you are in the luteal phase, right? So you have to think about what in the world is happening in the luteal phase. So if you see luteal phase, the corpus luteum is active and produces high progesterone and moderate estradiol. All right. So in corpus luteum is active at that time, and it is producing high testosterone and moderate estradiol. And these hormones exert negative feedback on the hypothalamus and pituitary, reducing FSH and LH levels. And inhibin A further inhibits FSH secretion. All right, so you are seeing high estradiol, high progesterone. All right, and so that makes sense. High estradiol, high progesterone, low FSH, low LH, and high inhibin. All right, folks. So think about, where are you? Follicular phase. Are you in the follicular phase, or at the ovulation, or in the luteal phase? Which phase? Where are you? Think like that. So you are in the luteal phase. the luteal phase, progesterone is high, corpus luteum is active. So that itself helps you to figure out what is going here. And the mnemonic I think about is luteal phase high pi, all right? Luteal phase high pi and a low flow. High pi and a low flow, that is luteal phase. So there are three things that are high and there are two things that are low. I mean, if you don't want to think about all those physiological maps, just remember this mnemonic. In luteal phase, three things will go up. Those are progesterone, estradiol, and inhibin. All right? The pi. I want to eat this pie. You can also say, I love this pie. All right? Love for luteal phase and pi. And the pi is high. So progesterone is high from corpus luteum. There is estradiol high, and there is inhibin is high from corpus luteum. All right, and so luteal phase high pi and a low flow, and flow FL, that is for FSH and LH. So FSH is low and LH is low. All right, folks, that's a very important mnemonic you can remember. What in the world is happening? Luteal phase, high pi and a low flow. Three things going up, progesterone, inhibin, estrogen, and two things are coming down, FSH and LH. So if you think like that, after LH, FSH, that is ovulation, the new corpus luteum takes over, secreting PEI. These three put brakes on the pituitary, so F and L drop. Why not number 2? Estradiol is going up, progesterone is going down. All right, so you can rule it out because progesterone is going down. Really, in luteal phase, that doesn't happen. So you can remove that off. How about this one? Estradiol is going down, and so estradiol here is still moderately elevated. All right, I told you, estradiol is elevated. So here it is low, so you can rule it out. How about number 4? Number 4 also progesterone is low. So you can rule this out because progesterone is high in the luteal phase. So let us go to the SUPER formula. SUPER formula is about looking at certain keywords and going to your answer in a few seconds. So what in the world are the keywords here? So if you see post-ovulation, all right, post-ovulation, and if you see the dominant secretory activity of the corpus luteum, and there is a circulating levels of progesterone and estradiol are markedly elevated, FSH and LH are suppressed. Inhibin A from the corpus luteum is high, all right. Then you are seeing thickened secretory endometrium. Then we are talking about mid-luteal phase. Now, if you see those keywords, the answer is mid-luteal phase. Inverse it. If you see mid-luteal phase, those are the keywords that you will see in the question step, like the progesterone is high, estradiol are elevated, FSH, LH is suppressed, inhibin is high. They are talking about mid-luteal phase. So the super point here, that is the most important thing you must put to your memory, is on day 19, that is mid-luteal phase, the corpus luteum produces high progesterone, high estradiol, high inhibin, but leading to low FSH, low LH due to negative feedback. So that's a very, very important concept. you can think about. So I will end this class here today, and follow us every week for this super fast review. All right, this master class is all about giving you the most important super points so that you can get a super score in your examination, folks. All right, I will see you in the next class.